Let's dive into this week's top stories. American Express cardholders may have had their information leaked in a recent data breach. The company says hackers may have accessed account numbers, names, and other related card information, such as expiration dates. Fortunately, systems owned or controlled by American Express were not compromised. Customers with more than one American Express card may receive multiple notices. They should review their account statements and report any fraudulent charges. A new study reveals costs associated with data breaches continue to rise. Poneman studied 553 organizations impacted by data breaches between March of 22 and 23. 51% of companies analyzed plan to spend more on security because of a data breach. The study also found companies who use AI or automate their workflow had on average data breaches costing $1.76 million less. The study determined the average cost of a breach is $4.45 million, an all-time high and a 2.3% increase from 2022. United Health Group faces a legal storm over the Change Healthcare data breach. Multiple class action lawsuits have been filed accusing the company of negligence. Plaintiffs argue UHG failed to implement adequate cybersecurity measures, which resulted in the breach that exposed the personal health information of millions of people. The lawsuits filed in Tennessee and Minnesota claim violations of HIPAA, the Federal Trade Commission guidelines, alleged negligence, and more. They seek compensatory, consequential, and general damages. They also seek court-ordered improvements to UHG's cybersecurity infrastructure to prevent future breaches. Indiana sues Apria Healthcare over a data breach affecting 2 million people. The breach happened over 2 years between April of 2019 and October of 2021. Hackers gained access to the medical and personal information of patients, including names, birth dates, social security numbers, financial account information, and medical records. The lawsuit accuses Apria of failing to implement reasonable security measures to protect the personal and medical information of its patients. It also alleges Apria failed to promptly notify patients and authorities about the breach, which is required by law. Is Google's AI Gemini HIPAA compliant? Gemini, Google's AI, previously known as Bard, helps you write, design, and organize with generative AI. When it comes to handling sensitive healthcare data, such as protected health information, HIPAA compliance is fundamental. So is Gemini HIPAA compliant? Our initial research suggests it can be HIPAA compliant. Under HIPAA, any software or service that handles protected health information on behalf of a covered entity is considered a business associate. Business associates are required to sign a business associate agreement, which outlines their responsibilities and obligations regarding PHI protection. Given Gemini's functionalities, it's probable that it would be considered a business associate when utilized in healthcare environments. Upon reviewing Google's official documentation, we found that Google does sign a BAA for certain services, as outlined in their support documentation. Gemini for Google Workspace is included in their BAA. Note, while Gemini for Google Workspace is covered under the agreement, access to Gemini via gemini.google.com or mobile applications is not included. Does HIPAA apply to AA meetings? Alcoholics Anonymous is a mutual aid fellowship rather than a healthcare provider or insurer. While members of AA are generally expected to respect each other's privacy and confidentiality as part of the fellowship's guidelines, HIPAA does not apply. Why does HIPAA not cover AA meetings? The absence of formal healthcare transactions, such as billing medical services to health plans, further delineates AA from the activities that would categorize an organization as a covered entity under HIPAA. Now, HIPAA mainly applies to covered entities. In contrast, AA's approach to data is inherently informal and non-systematic. It does not collect, store, or transmit PHI in a manner that necessitates HIPAA compliance. Any interactions within AA are based on voluntary participation. Now, this exchange of information is verbal and occurs in a context of mutual respect for privacy without creating written records or employing electronic systems to document or manage the information shared.